Hello,
Hi.
my name is Shelley Carlton,
Yes.
and you are Miss Crawford.
Yes.
And I understand that you are having some back pain.
Yes.
When did you start having the back pain?
Possibly around about a month and a half ago. That's when the back pain started.
Was there something that you was doing that led up to your back pain starting?
I think I was at work and we had a heavy patient and we were trying to pull him up in bed. And so on the count of three, I said on the count of three, we'll pull him up, and everyone wasn't ready. And I think I tried to pull on him by myself, and I kind of tugged him by myself when everyone else wasn't ready. And so I believe about that's when the pain started, about a month and a half ago, when that episode
Was
happened.
it gradual? Did it start gradual, or was it just all of a sudden?
It it's kind of been. I noticed when I got off work that it was kind of hurting, and then the pain just kind of been kind of achy, like nagging, like just an uncomfortable feeling sensation back there. And I've been taking ibuprofen and some Tylenol to kind of help relieve the pain. Lower back.
Um, is it in just one spot, or is it all across your back?
It's just in one spot. One spot.
On a scale of 0 to 10, with 0 being no pain and 10 being the worst pain, how would you rate your pain?
Sometimes it can get up to a 10 sometimes, but about right now it's about a 5, 6. I can tolerate it. I've taken some Tylenol about an hour and a half ago before coming in.
Did
So
that help?
yes, the Tylenol does help, but I like to see if something's I can't if something's wrong. I know I shouldn't be having that pain for this long. So
Okay. Um, have you done anything else, like trying to rest your back or?
when I do take when it does hurt, when it's really excruciating on a 10, I go lay down. I take the Tylenol and I go lay down. I get off my feet. I try not to do anything to try to make it worse. So,
Okay. Let me ask you some
and a
questions.
heating pad also helps.
It does help?
Yes.
Good. Let me ask you some questions about your past medical history. Do you have anyone, uh, have you had any kind of trauma to your back or any injuries to your back before?
No, not before this incident.
Okay. And have you had any surgery or anything like to your joints or to your back or
No,
bones or?
no, no,
Okay.
no.
Let me ask you some family history. Do you have a family history of anybody in your family having scoliosis or gout or
No, no.
arthritis, osteoarthritis?
My grandmother on my mother's side has arthritis, but
Arthritis.
that's all.
Okay. And do you have, does anybody in your family have genetic disorders,
No,
having any kind of bone genetic
no.
disorder? Okay. Um, Let me ask you some questions about your personal history, family history. Where do you work at?
I work at the VA.
Okay, and what exactly do you do?
I'm a registered nurse.
Okay, and in that job description, what do you do?
Everything. As far as lifting, turning, cleaning,
Yes.
assessment, passing medication, I do everything.
Okay. Do you use standard precautions and
Yes,
try to use safety?
yes,
Um,
yes. And also we have a lift system in place where we have to have a yellow sling type like up under the patient and use the lift system. And was it utilized that day? No. So
so how many of there was you that was pulling on the?
two on each side.
Okay. Does anyone are you able to usually dress and take care of yourself?
Yes.
Do physical activity?
Yes.
Does Do you have any problems with climbing stairs or walking or sitting in a car for a long period of time?
Now I can't sit down for a long period of time since.
And does it seem to get worse or better or when you do?
When I'm sitting for a long time, the pain comes on and it gets worse, and then I have to kind of get up and move around and kind of reposition myself. Yes.
Good. And do you smoke?
No.
Do you drink?
No. Drinking's bad for you.
Okay. Well, that will conclude our history presentation.
Okay.
Thank you.
You're welcome.